School-based feeding program amidst the pandemic and its impact on the pupil beneficiaries, an evaluation. What is this about? An evaluation on the implementation of the school-based feeding program amidst the pandemic and its impact on the pupil beneficiaries. The researchers. Rationale: the school feeding program helps to increase enrollment and academic achievement in schools. The SBFP takes into account the fact that there is no face-to-face interaction during the COVID-19. The school feeding coordinator is in charge of the SBFP's administration. The Department of Education issued DO number 31, series of 2021, which aims to maintain its commitment to providing nutritious food to students in the face of the COVID-19 pandemic. The SBFP complies with the Republic Act No. 11,037, otherwise known as the Masustanciang Pagkain para sa Batang Pilipino Act, signed by President Rodrigo Duterte on June 18, 2020, and was later augmented in the Bayanihan to Heal as One Act. Hence, this study evaluated the implementation of the school-based feeding program amidst the pandemic and its impact on the pupil beneficiaries. Key literature: children require a consistent food supply to support their metabolic needs for body growth and brain development, according to Akenby, 2013. Children who are in good health learn more effectively. People who receive appropriate nourishment are more productive and can help to break the cycle of poverty and hunger over time by World Health Organization. According to Lawson in 2012, setting priority to school feeding program is fundamental involvement in reducing the short-term hunger, providing learners cognitive function. Research questions: the primary purpose of this study was to evaluate the school-based feeding program amidst the pandemic and its impact on the pupil beneficiaries in Dapdap Elementary School, Tagaytay City in SY 2021-2022. Specifically, it sought to answer the following questions. 1. What is the demographic profile of the pupil beneficiaries in terms of age, sex, nutritional status, educational attainment of parents, and monthly income? 2. To what extent has the implementation of SBFP attained its goal in terms of improving the children's health and nutrition in the midst of the pandemic? 3. Is there an improvement in the nutritional status of the pupil beneficiaries before and after the implementation of the school-based feeding program? 4. In what way has the SBFP affected the pupil beneficiaries? Basic research methods. A. Participants and/or other sources of data and information. The subject of the study was 65 pupils from grade 1 to grade 6 who were categorized as wasted in their nutritional status for SY 2021-2022. B. Data gathering methods. Purpose of sampling technique: as the pupils have already been identified based on nutritional status, it used qualitative approach. Distribution of pupils per grade level is shown on the table. Research findings in terms of age: the graph shows that the majority of the beneficiaries were 9 years old, garnering 18 pupils. Meanwhile, there was no recorded beneficiary at the age of 11. Sex: the graph shows that 55% or 36 among the beneficiaries were male and 45% or 29 pupils were female. Nutritional status: the graph shows the difference in number of wasted beneficiaries before and after the implementation of the SBFP in each grade level. It can be gleaned that from 65 wasted pupils before the implementation, it dropped down to 11 pupils after the SBFP. Educational attainment of parents: it can be gleaned from the graph that the majority, which is 63% of the parents of the beneficiaries, were high school graduates, meanwhile 2% were an elementary level undergraduate. Monthly income. The table shows the beneficiaries' family's monthly income. It can be gleaned that most of them, which was 36%, were earning greater than or equal to PHP 7,000 in a month. However, this also showed that there were beneficiaries who were earning greater than or equal to PHP 3,000 in a month, which was 12% of our beneficiaries. Conclusions. On the basis of findings obtained through the analysis of data gathered, the following conclusions were arrived at. 1. The given set of graphs above revealed that the SBFP program, amidst the pandemic, had great impact in the children's health and nutrition, as it showed that the number of beneficiaries was lessened after the implementation of the program. 2. The SBFP has greatly helped to cure malnutrition. It also contributed to improving the children's health and nutrition. 3. The beneficiaries were very grateful for receiving the meals. The modules were not the only ones they look forward to weekly, but also the delicious fruits, breads, and milk. Recommendations. 1. Carry on with the implementation of the SBFP because it is a great way to support our learners by providing them nutritious food that would surely help them to stay healthy. 2. Continue to eat healthy foods to avoid malnutrition and disease, especially during the pandemic. Here's our references. Thank you.